I am the Lord, your healer, and I sent my word, and I heal your disease. I am the Lord, your healer. I am the God that healeth thee. I am the Lord, your healer. And I send my word, and I heal your disease. I am the Lord, your healer. You sent your word, and you healed my disease. You are the Lord, my healer. First Corinthians 10 and verse 31 says, "Whether therefore ye eat or drink or whatsoever ye do, do all to the glory of God." Greetings to all our listeners and viewers of this program. Welcome to another edition of Nature's Way here on Waves 96.3 FM, where we take you on a path to a healthy, wholesome living. I am Debbie, and with me this evening is Nebert, who is also a producer of the producer of this program.
Thank you so very much. Good to be here with you, to be able to share in this program with you. Thank you.
Yes, and happy to have you sharing in this program with me today, Nebert. I just want to give a special shout out, Nebert, to Bernadette Pink.
Oh, yes,
Yes,
yeah.
yes, who is celebrating another year of life and
Oh,
health.
okay.
Yes,
Yes.
happy birthday,
Happy birthday.
and may God
Right.
continue
Happy
to
birthday.
keep you in good health,
Yes.
and may He grant you your heart's desires.
Happy birthday. Happy birthday. Happy birthday.
Yes, I hope you have been having a wonderful day, and for
Yeah.
our listeners and viewers, listeners on Wave 96.3 FM, I hope you have been having a wonderful day and that all is going well so far. I know some persons may be having their Sunday dinner now,
Yes,
or just about finished,
Yeah.
or some persons may have it later on.
Mm-hmm.
But I hope that you have a healthy, a balanced plate of food in front of you, and you are having a balanced diet, a healthy meal this evening.
Yeah.
Yes, so we're going to be looking at the skeletal muscular system. We're going to be zeroing in on a few, a few conditions that that are affecting persons. We're going to be looking at the bones, first of all, as a precursor to what we're going to be discussing this evening, because it has to do with the joints and the muscular system. And also, we're going to be looking at arthritis, which a lot of persons are having issues with. And, there are several types of arthritis.
Yeah.
And we hope to, share some with you this afternoon if we're not able to share all. But I trust that the information that will be disseminated will be useful,
Yeah.
and that, God's name will be glorified,
Yeah.
because He's the one who points us to these discussions, and, and we hope that they are useful to you.
Yes.
But before we get into our program and our discussion, Nebert, I just invite our listeners to bow your heads with us as I pray. Kind, compassionate Heavenly Father, thank you for your mercies and your grace towards us. Thank you for all that you do on our behalf. We are grateful, Lord, that you have afforded us this privilege to be co laborers with you. And I pray that as we labor with you, I pray that as we go through this afternoon's program, that your name will be glorified and persons will be blessed. Be with us now. Touch everything in studio so that it may work at its optimal. Bless and abide with us, we pray, and say thanks in Jesus' name. Amen. Amen. Yes, just a reminder there that you're listening to Waves 96.3 FM. And
Yes.
indeed you are.
Yes.
Indeed we are. Yes. So just want to say welcome again, and that we're going to be going into our discussion. But as a precursor to our discussion, Nebert, I just want to briefly look at the strengthening of the bones, since it's a part of our skeletal system. And most of the things that we'll be discussing this afternoon has to do with the bones, right? So it is important that you maintain strong bones. And we maintain strong bones by feeding it with the feeding our bodies with those minerals and vitamins that we need, that our bones need. And persons will tell you right off the bat that you need calcium, but it is not just calcium.
Right.
As we have discovered and have discussed before, it is not just calcium. We have so many minerals and nutrients that we need to get in our diet in order for us to have healthy, strong bones.
Right.
Right.
And we're told that the bones have 60 odd minerals, main minerals.
Yes.
And 12 of them are so important.
Right.
You cannot do without.
Yes. And some of them include potassium, calcium, of course, magnesium, and our vitamins.
Yes.
We need to have bromium and so on. And we need to have all of these in our diet.
Yes.
So this is what we would call a balanced diet.
Yes.
Right. So we need to get in our vitamins, and sunlight is the best source of vitamin D, because a lot of persons will tell you they are taking their supplements and what have you, they don't go out in the sun as much. But in spite of what is happening out there, and in spite of the things in the atmosphere, we need to get in
sunlight.
Or sunlight,
it is not blocked completely.
Not completely.
It cannot be completely blocked.
God is merciful.
Yes.
God is indeed merciful. Yes, and so we need to ensure that we have strong bones, and we need to strengthen our bones, and we need to put in all the nutrients, vitamins, minerals in our bodies. We need to make sure we eat plenty of vegetables, raw and steamed vegetables, and make sure that you get in your leafy greens.
Yes.
And
the deep leafy greens.
Yes, those broccoli and purslane that has so many, all the minerals that you can think of is contained in purslane.
Yes.
Yes, and make sure that you get in your proper dosage of flaxseed oil, which helps the body to produce hormones needed for good bone development.
And omega-3.
And omega-3, yes. And make sure you drink a lot of water, plenty of water, and make sure that you eat your quinoa and so on, and your fruits and so on. So you need to ensure that all of these are in so that you can strengthen your bones. We have counsel from our Lord, who loves us so much. From this wonderful book, Counsels on Health, and also this that I will be reading is also found in the book Desire of Ages, page 823. And it says, this world is a vast laser house, but Christ came to heal the sick, to proclaim deliverance to the captives of Satan. And by the way, the title of this reading is Christ's Manner of Healing.
Yeah.
And this is one of the reasons we are here, because of his manner of healing.
That's correct.
And we want to share it with all of you. He was in himself health and strength. That's Christ. He imparted his life to the sick, the afflicted, those possessed with demons. He turned away none who came to receive his healing power. He knew that those who petitioned him for help had brought disease upon themselves, yet he did not refuse to heal them. And when virtue from Christ entered into these poor souls, they were convicted of sin, and many were healed of their spiritual disease as well as their physical maladies. The gospel still possesses the same power, and why should we not today witness the same results? And this is why Nature's Way is here, to remind you of these, that the God is the same yesterday, today, and forever. He
That's
does
right.
not change.
Yeah.
And if he heals back then, he will heal. He himself is health and strength.
Mhm.
So we need to put our trust in him so that he can heal us. Now Christ feels the woes of every sufferer. When evil spirits rend a human frame, Christ feels the curse. When fever is burning up the life current, he feels the agony. And he is just as willing to heal the sick now as when he was personally on earth. Christ's servants are his representatives, the channels for his working. He desires through them to exercise his healing power. In the Savior's manner of healing, there were lessons for his disciples, and as is for us today. On one occasion, he anointed the eyes of a blind man with clay and bade him go wash in the pool of Siloam. He went his way, therefore, and washed and came seeing, according to John 9 and verse 7. The cure could be wrought only by the power of the great healer. Yet Christ made use of the simple agencies of nature, which is the clay, while he and the water. While he did not give countenance to drug medication, he sanctioned the use of simple and natural remedies. To many of the afflicted ones who received healing, Christ said, "Sin no more, lest a worse thing come upon thee." John 5 and verse 14. Thus, he taught that disease is the result of violating God's laws, both natural and spiritual. And those 8 laws that we have so often mentioned on this program. So, both natural and spiritual, the great misery in the world would not exist did men but live in harmony with the Creator's plan. Now, these lessons are for us.
Yeah.
There are conditions to be observed by all who would preserve health.
Mhm.
All should learn what these conditions are.
Yes.
The Lord is not pleased with ignorance in regard to his laws, either natural or spiritual. We are to be workers together with God for the restoration of health to the body as well as to the soul.
Yeah.
And this is one of the reasons Nature's Way is here this afternoon. We want to be co-laborers with God in assisting you to a healthy, wholesome living. And we are emulating what God has done when he was here on earth. When Christ was on earth, he healed the sick with the natural remedies. Now, can you imagine telling somebody today to go and use clay on your eyes, and then you go in the river and wash, right? And we looked at Naaman this morning in our study, and it was just natural remedies that Christ used to heal. And of course, he is the great healer. So we need to trust in his words. And this is why we are here to share with you this afternoon these remedies and this information that you can use them. All right. So for those, go ahead.
No, I was saying that the part of what you presented just now that I
Mhm.
really enjoyed listening to was a section that says that the Lord sanctioned the
Mhm.
use of simple and natural remedies.
Yes.
He does not sanction drugs
No.
in any way at all.
Mhm.
Simple and natural remedies.
Remedies.
Because
Mhm.
if we think about it, these are the things that when we are at our lowest ebb, when
Mhm.
we are the sickest, when we are the worst in our life, these are the things that work.
Yes.
And we find that the drugs have too many complications, and one normally leads into another.
Into
And it
another.
is it is one incessant bag or pharmacy of pills that you travel around with.
Yes.
And so simple remedies, and usually when you do one remedy, it is good for other things that
Other
are occurring in
things.
your body and you didn't even know.
Right.
Yes.
Welcome, Terry. Good afternoon. Nice to have you on. Hope you have been having a good day so far. And welcome to those who are in Radio Land. Yes, so we're going to be looking at Nebert. Some of the some conditions, and then we're going to be looking at some of the remedies that we
Yeah.
can use, these natural remedies that our Father in heaven has given to us to
Yes.
use. So one of the things that a lot of persons are suffering from or complaining about these days are knee pain.
Hmm.
Is knee pain, I should
Yes.
say. Yes, so knee pain. And of course, the symptom is pain in the knee.
Right.
Pain either in the knee or close to the knee. All right. And in severe cases, it may be difficult to also bend the knee.
Right.
All right. So the problem is generally inflammation of the bursa in the front of the kneecap. So the tendons of the knees may be also injured. Obvious causes can include running, if you are a sports person, jumping, climbing the stairs, scrubbing the floors, um, sports, yes, bumping against hard object, the furniture, and so on, poor posture, and leaning against a ladder for some persons. So it depends on the occupation as well.
Hmm.
Right. So some persons who does a lot of construction work, when they're putting up what is it called, the cantilever and so
Yeah.
on.
It's cantilever. Yeah.
Yes, and you
Hmm.
lean you press your knees
Hmm.
against the ladder for a long period.
Or even when you're nailing and stuff, and you
And you're
use a knee
kneeling
to hold it
down.
up.
Yes, right.
Hmm.
So these can, and you find that you get these pains and this wear and tear over
Hmm.
time,
Hmm.
and so it you put stress on the tendons and on the kneecap, and then after a while you end up with knee pain. And there are some natural remedies that you can use for that as well.
Hmm.
One of the one of the most common is to putting ice on the knee, and this is a soothing natural remedy. So you're going to make sure you have ice in your freezer at all times, and also make sure you have an ice bag or an ice cap in your freezer. All right. What you can also do is just fill some paper cups with water and freeze them, and you can use these to put on the knee.
And that's to relieve the pain.
Right, to relieve the pain. And then you can also keep water soaked ace bandage
Hmm.
in the freezer.
Yeah.
If sometimes you're going to be doing some sort of work over time, and you suffer from this condition, you can you know, get ahead and put these things, have these remedies on hand. So you can put these cold packs on the knee, and you can rub the ice on the knee, and so forth. Now, after applying the ice to the knee, you can stretch the stiff or sore muscle to restore the range motion, because sometimes after a while it gets stiff and sore, and you're not able to bend it in severe cases, as I mentioned. So when you put the ice on it now, you want to move it so that you have that motion, and then you have the blood circulating.
Yeah. And
Mhm.
it is important that you don't allow the area to heal. without bending it,
Yes.
because when it is healed and it is not, and you the muscle memory is very important. So when it is healed and it is, the memory has been gone, then when it is, sometimes you walk with a stiff leg, you can't bend the area because you did not practice bending it,
Bending it.
right?
And I know someone who went through something like that to get the knee bent
Yes.
after a while,
Oh yeah.
and that pain was excruciating
Oh yeah.
according to the individual. So, that is very important, Nibert, that you get the motion going.
Right.
So, after you have applied the ice, you stretch the area, stretch the muscle, and then you put it in motion.
Yes.
So, the stretching should be gradual and
Right.
not jerky. So, you
Yes.
take your time, no rush. All right. So, you gently stretch them, and then you put on the ice again for about 20 minutes at a time. You can do this 3 to 4 times a day for at least for 2 days. After the 2 days, you're going to apply heat. So moist heat is best, or even a hot. You can take a hot shower for about 15 minutes intervals 3 times a day in order to get, because this now is the hot and cold treatment. So if you are overweight and it's putting pressure on your knee, what you need to do is lose some pounds. All right, so it will take a lot of pressure off the knees if you do that. All right, so if you have to kneel, make sure you wear protective knee pads. And if you have to work below your waist, you can sit on a stool or sit on the floor if you are able to get up. So you can do that. All right. So persons who love to do gardening, sometimes they kneel a lot. So you can put a foam cushion under your knees. All right. And then what you do, you keep shifting the weight from one to the other, and don't stay down for too long. All right. So because you need to get the motion, change the positions at intervals. All right. When you're sitting for a long time, keep shifting your position as well. So you can get up and walk around for, after every 35 to 40 minutes in order to get your blood circulating and so on, because you don't want to get seized up and then get the pain again. So if you do fast walking, do not overextend the knees, or pain will develop in the tendons in the back part of your knee. For normal walking or running, keep the knees slightly bent. All right. So sometimes when you're doing your exercise, you're walking, and so you may stop a bit and just bend the knee and lift the knee so that it can um, have that movement. Do not wear thin soled or high heeled shoes. Walking shoes should be cushioned, well cushioned, especially at the heels. All right. So if the pain starts, stop what you are doing and do the rice method. Now, let me tell you what the rice method is. We have shared it before, Nibert, but let me remind you what the rice method is. First is rest. So you're going to rest the knee by sitting or laying down. Then you're going to put ice on the knee, and then you're going to do the compression. So you compress or wrap the knee gently, and then you're going to elevate your leg. All right?
So it's rest, ice, compress, and
And
elevate.
elevate.
RICE. Okay.
RICE. Yes, and it is very effective. It is a very effective
Yes.
alternative.
Mm-hmm.
And then you can do the alternate with the hot and cold to the area. All right. So um, persons will tell you that, man, if you have a knee pain, you need to do squatting, but you need to minimize the squatting, because, or climbing stairs, because you don't want to put any stress on the kneecap, right? And then on the thigh, because you can put a lot of pressure on it and stress on it, and compound the problem.
Mm-hmm.
All right,
True.
so you can do a little massage of the area as well, not too hard. You're healing, so you do it gently. All right, and
And
it's
don't do too much at the same time.
not at the same time,
Mm-hmm.
because it has been
Mm-hmm.
damaged over time,
Yeah, so
so it
progressively do it.
takes a while to
Yes,
come back, so you
progressive.
need to do it. Yes,
Mm-hmm.
yes, and just wear some flats and comfortable shoes and all of that. All right, so if there's swelling, you know that it is inflamed, and the pain and the swelling, you know that it is inflamed. All right, so what you need to do is just use your thumb and press on the area a little bit and just give it a little circular motion
Mm-hmm.
for it to, and then do the hot and cold.
Yeah,
And there,
promoting blood flow.
blood flow,
And the
right?
reason you do it circular and not stroke
Sure. Mm-hmm.
is that you want the blood to circulate
Mm-hmm.
in the way that the muscles are
Are
formed in your
formed.
knee.
Right,
Yeah, yeah.
right, right,
Mhm.
right. And of course, as counsels on healing have just reminded us that God is the great healer, and we cannot do anything without him. So we need to consult with him, and we need to make our requests known
Mhm.
to him. We are having knee pain, and as simple and as trivial as it may sound, you're having knee pain because of things that we do or
Mhm.
things that we not do, because sometimes we become so immobile. We don't exercise as we should.
Complacent in our movement.
Right, especially persons who do the sedimentary
Yeah,
jobs,
you work at a
and you
desk, yeah,
mhm,
etc. Yeah,
for long periods, and you
right.
sit and you don't move around much,
Mm-hmm.
and then with age as well. And I was reading something the other day, and the person was sharing that age has nothing to do with it, because you have persons who are much older than I am who are very active.
Of course.
It's because we become inactive, and we tell ourselves that we don't have time to exercise and we don't have time to do, but we have to make the time. Remember, strengthening our bones and our muscles comes with is a result of exercising as well, not just diet, right? So we need to do that. So never is one repulsed who comes to God with a contrite heart. So remember that we can come to him, and we can ask him for help as well.
Yes.
Mhm.
True. Remember that as good as the herbs or the hydrotherapy is,
Mhm.
they are not good without God, because it is God who provides the healing. It
Yes.
is, and so these are just assisting in
Mhm.
healing us. But if we want a complete and proper healing, we must ensure that we bring God into the mix of it, put everything into His hands and let Him deal with it.
Yes, after
Yeah.
all, he's the great healer.
Right.
So there are other knee conditions, Nebert,
Hmm.
that we want to look at. One is called Osgood Sclatter's syndrome, right? And this one is it comes with age, and it comes with growth, and it comes with maybe like your hobby or your job that you do.
Hmm.
Persons especially who do sports and all of that. So of course it's knee pain and stiffness. So it's not just knee pain alone, it comes with stiffness as well. And there may be swelling about the knee and also tenderness when it is touched. So it is tender to the touch, and that it is more severe than just a knee pain. Pain is often worse when jumping, running, or climbing stairs. The knee is usually sore to the pressure at the point where the large tendon from the kneecap attaches the prominence below. Now, the patellar tendon, which normally attaches to the tibial tuberosity, has been strained by the powerful um, quadriceps muscles. Now, this tearing, and the medical term is avulsion, can be extremely painful and is sometimes disabling. And it is said that teenagers, especially boys, experience this problem more frequently than others,
Yeah.
and it often occurs during or shortly after a growth spurt.
Mhm.
It is common in those engaged in sports as well. Osgood Sclatter's syndrome may occur in both knees at the same time. Now, the problem tends to occur during the ages of 10 to 15 in boys and 8 to 13 in girls. It generally lessens over a 2-year period as the youth grows. The bone overgrowth may cause a protuberance, or protuberance, meaning it protrudes so you can actually see it. Children with Osgood Schlatter syndrome were formerly restricted from physical activity. Now, most orthopedic physicians let the child decide his own level of activity. So, depending on the severity of the pain, the child will be able to do some activity. And it comes, as I said, it is growth related, and it also stems from repetitive stress, um, meaning that you keep doing the same thing over and over. Yes, so it comes from that.
Mhm.
Yes.
Yes. This is when a child is growing. Sometimes you may notice that there are certain protrusions, things, the bones seem to be protruding, but it is growth. Growth is taking place, and because this is happening, as you rightly said, um, some person might believe it is abnormal. Sometimes when the growth continues, the person grow it out, but it is many times it is painful. Understand that this is an intrusion on the person's, but it was not always there, and it is happening. And so, because it is happening, it causes a little bit of pain. And one of the things that we have found out is that when you get to the section where we deal with the pain, how to relieve the pain, then we realize that there are some remedies that might seem um, quite amazing, but they work. That I'll share with you.
Mhm. Yeah. So most of the times, Lieber, the first action that is taken is the
Mhm.
person is restricted from carrying out or continuing the activity.
Right, which is so bad. Yeah.
Yes, because
Mhm.
it is painful.
Yeah.
But what is advised is
Yes.
that you don't completely stop the activity.
No.
You
No.
continue
You continue.
the activity to the
Right.
level that is bearable.
Right.
Right.
Because yes, because if you stop it, then the pain would continue. The person would not be able to manage
Mhm.
um, the similar activities as growth continues. Remember that the person is growing,
Mhm.
and sometimes these things happen when growth is taking place, and this is
Yeah.
what we should understand. Because when growth takes place, a number of things are happening to your body,
Mhm.
and because these things are happening to your body, sometimes you regard it as abnormal, when in truth and in fact it is not. It is just a normal process of growth that is taking place.
Growing pains.
Growing pains.
Yes. So, and one of the natural remedies that it has been found that vitamin E
Yes.
and selenium,
Hmm.
these have been very helpful in improving this situation. And you will do this in about 2 to 6 weeks. You will
Yes.
find that there is improvement. So
Yes.
you see, we are dealing with the bone,
Right.
and these are some of the minerals and vitamins that we need in the
Yes.
bone as well, not
Right.
just calcium.
Mm-mm.
Sometimes you need to have more intake
Mhm.
of vitamins E and selenium
Oh yeah,
in your
because
diet.
yeah, and calcium. I think persons associate bones with calcium because of a marketing strategy that was used.
Yes.
Persons wanted you to drink milk, and so they use that to say that you should consume a lot of calcium, because
Mm,
calcium is not even the most important nutrient that is needed for bones, because
mm,
there's phosphate and selenium and all other types of, there are 12 main minerals, of which calcium is maybe comes at number 10 or
mm,
somewhere thereabout.
mm,
Another natural remedy is that um, you cause the person to go on the outside and to take deep breaths, deep breathing, and be deliberate in the breathing.
mm,
Be very deliberate in the breathing, but in this deep breathing, and let that air circulate throughout your entire body. It is amazing to note that when you do this, it provides relief from pain. When you take deep breaths and allow the air to circulate, and deliberate air, not just quick deep breathing, but slow. Take in, and then you keep it there for a little while, and then you release by the count of maybe five or so on. And you take it in, and then you release again. And so you develop a rhythm.
mm.
And then slowly but surely you find that if there's pain, then it will disappear. And this goes for any type of pain that you have pertaining to the bones.
Yes. And um, persons will tell you if you are experiencing pain or excruciating pain, as I said before,
Mhm.
you are to avoid, but it is not to avoid. You can restrict the activity in that you don't totally avoid it, but you
Mhm.
do it less or use and do another exercise because you need exercise.
Oh yeah.
All right. It is part of the healing process.
Yes.
Activities such as running and climbing may need to be reduced or stopped only for a time,
Mhm.
right? But you can do quadriceps
Mhm.
stretching exercises during a warm up period prior to the active exercise. So if you are not able to do the that active exercise, you can do the stretches,
Mhm.
right? As if you're warming up to do the exercise.
Yeah, you do the
So
stretch
you do
before
the
warm up.
stretches
Yes.
before
Yeah.
before you do the exercise,
Yeah.
which is the warming up.
Yeah.
So you would do the
Wow.
stretches instead of the exercises
Mhm.
until you are able to go and do the
Yeah.
actual exercise, if you
Yeah.
understand
Yeah,
me.
you do the
Mhm.
stretches first,
Mhm.
and then you do the warm up, then you do the exercise. So
Mhm.
there are three things: the stretches, warm up, and exercise.
Mhm.
The stretching, you do the stretching because of what your body is about to be involved in,
Mhm.
and then you do the warm up because you don't want to go directly into the
Into the
exercise
exercise.
that may damage your body.
Mhm.
And so when you begin to do the exercise, or because you have already stretched and because you're already warmed up, then your body knows what is coming and
Mhm.
can accommodate the intense action that will then take place with your body.
And the stretching is very important because remember this condition, Osgood Schlatter syndrome,
Yes.
comes with stiffness, not
Right.
just pain.
Right.
So the stretching is also good and it will help. So exercises which strengthen the quadriceps are helpful after the pain subsides.
Mhm.
So you don't do it during the pain. Make sure the pain subsides because you are going to cause further complication.
Yes, in the Osgood-Schlatter syndrome,
Mm-hmm.
this has to be done. There are some other types of situations that
Mm-hmm.
you'll have to exercise
Size
during pain,
during the pain.
but in this particular syndrome, you
Right.
have to do it after, because it will cause a problem in the
Mm-hmm.
development, in the bone development of the person,
Mm-hmm.
and so you have to be very careful
Yes.
how this is done.
Because we in this condition,
Mhm.
remember that it is the particular activity that you
Mhm.
have been doing over time
Yeah.
that causes this condition. So it means that you are going to have to desist from doing that particular activity, but you still need to exercise.
Yes.
Right.
The bone growth, when you're
Mm-hmm.
having a particular type of, it happens, as we said, during in teenage
In
years,
teenage,
right?
yes, yes.
And it is,
Well, I'm speaking to the sports part
yeah,
of it,
yes,
but
man, yeah,
yes, the teenage part
right,
of it, the growth part of it.
yes. And so when the bone growth takes place,
Mm-hmm.
then things happen to your body, because this is something um, that is growing. Your bones are growing,
Mm-hmm.
and it could also be that the other areas are not catching up
Catching up,
with the growth of
right,
the bones.
right,
And so this is why this problem occurs.
right.
And so when you understand this, you will know how to deal with the
Treat with
situation,
it,
treat with the
right.
situation.
Mm-hmm.
So all your body would normally develop in tandem with each other. But sometimes,
Mm-hmm.
because of how especially boys are, the growth takes place more haphazardly. So you have to just be
Mm-hmm.
careful, watch it,
Right,
and make sure that you do the right things at the right time.
right.
So number two, number two, third one.
Okay.
Mhm.
Yes, that was frightening.
Mhm.
Right, right.
Mhm.
And this is why sometimes you see a protrusion because
Yes,
it's not catching up, as you
right,
said.
right.
Right. But but there, once you know the condition
Hmm.
and understand it, you'll be able to treat better with it.
Yeah.
And there is another condition too, Nebert, that has to do with knee pains.
Hmm.
All right, and this is inflammation in the knee, and this one is called um, chondromalacia.
Hmm.
Now, chondromalacia, the symptoms vary in severity in different persons,
Yes.
but they may include pain in the knee
Hmm.
when the leg is bent and straightened,
Right.
as in going up and down a stairs.
Right. So we are telling you different types of knee pain
Mm-hmm.
that you may have, because usually when somebody have a knee pain, the first thing that they normally say is that it is arthritis. When in truth and in fact, it may not
Not pain.
necessarily be
Mm-hmm.
that you are experiencing arthritis,
Mm-hmm.
but it could be Sandra Jamalsia. All right.
Malaysia.
Right.
Mm-hmm.
It could be that that is
Yes,
the
Contra
problem.
Malaysia.
Right. Chondromalacia. It could
Mm-hmm.
be that that is a situation that you're going through.
Mm-hmm.
So if you could identify what is happening to you, then you would be in a better position to get the remedy.
Right.
Because sometimes you might miss something, might be misdiagnosed, or you might be applying something that is wrong to
Right.
you might be applying the wrong remedy.
Right.
Yes.
Right.
Mm.
So, um, stiffness may be experienced
Hmm.
after prolonged sitting,
Hmm.
and crepitus, which is a crackling noise. I remember when I was going to school and we were doing physical education, and every time we are doing squats, I would get that crackling sound in my knees. And it happens every single time. Every time, And now I am realizing that this may have been the condition.
Hmm. San, Sandra Malaysia.
Yeah, Conjo Malaysia.
Hmm.
Yes,
Hmm.
when I was doing the
Hmm.
research, I recognized that this could very well be the condition.
Hmm.
So you will get this crackling noise during the knee movement. Now, the problem usually, but not always, occurs in only one knee. Sometimes it's in both.
Hmm. And
Right.
I find that children normally experience this,
Uh-huh.
Most
Yes.
99.9%
Yes.
of youth
Yes.
growing will experience
And
this.
it goes
Hmm.
away with exercise too,
Hmm.
Yes. But this now is if you have not been moving for a while, you will get this condition.
Hmm.
So this condition can be easily fixed,
Yes.
right? So um it it can be caused by strenuous exercise. So what you need to do is to, and if you had like a knee injury before, it can happen as well. Now, it is because of the softening of the kneecap cartilage. So this cartilage surface of the back of the patella, which is the kneecap, that has been damaged, and this is can, as I said, because of strenuous exercise or repeated knee injuries. Now, in teenagers, we are going back to growth again. It can be caused by increased weight bearing on the knee joint during growth spurts, right? But uh, it can, your muscle can be weak as well in your upper leg, and this may be part of these may be part of the cause.
Yeah.
So
So yeah.
you need to strengthen the muscles
Right.
by exercise.
Right. Because you don't not um one of the, one of the things that you have to do is to ensure
Mhm.
that the development take place with each other. Not you're not just developing one section,
Right.
but when you're exercising, you're developing the muscles,
Yes.
and that you're also doing the bones.
Mhm.
All right, and so you must not just saying that boy are going to be doing this area,
Mhm.
and so this area is not going to be affected. I'm not going to affect this area. It
Mhm.
has to be done in
In
tandem
tandem.
so that
Also,
the development can take place properly.
it also has to be done in tandem with your diet.
Right.
Right.
That's
Because
right.
a lot of persons exercise, but they don't diet properly.
Right. And
And this
always
causes
remember, yeah,
problems too.
always remember that proper breathing is so very important too. So
Mhm.
as you were telling me this morning when we were exercising, that we must allow the oxygen to flow through the body. So deep
Rapid
breaths are
breathing. Yes.
important. Proper
Yes.
breathing is so very important.
Mhm.
Yeah.
Mhm.
Mm.
And recovery can usually occur within several months
Mhm.
if strenuous exercise is not resumed prematurely. So, eat a nourishing diet, and if you are not careful, there is increased risk that in later life you may develop osteoarthritis,
Right.
as we will look at later on
Right.
if
And
time
you don't want
permits.
this to happen. Yes.
No, no.
Right.
So you see, diet is very important.
Yeah.
So during the development with these, especially these two last conditions that we have looked at, during the development process or the
Hmm.
development period, the growth
Hmm.
period, it is important that proper diet, is practiced
Hmm.
and exercise. All
Yes.
right, so we need to ensure that. Now, by faith, grasp the hand of Christ and trust Him as fully in the darkness as in the light.
Hmm.
All right. So we must remember that trust in God is very important, and it is a part of the eight laws of health.
Yes. Whatever it is that we are doing, when especially when you have an illness,
Mhm.
it is very important to note that trust in God is optimum. It
Mhm.
should be at its optimum level because you are leaving everything in the hands of God. You're putting yourself in God's hand. And because it is outside of your hands, then you're putting it in somebody else's hand. This is God's hand you're putting it in. And so you must understand that when you should accept however God deals with it. Sometimes it is not exactly how you want it that it happens. It is how God says that it should be that is happening. And so you trust God to do what is best for you. Because sometimes we have things in mind that are not exactly right. And so we want it to happen this way, which will result in more harm to you. But when God heals, He heals you wholly. And so, because He heals wholly and completely, then it is best to allow Him to control and to do the healing so that trust factor is so very important
Very
there.
important.
Mm.
Very, very important. And we're going to be looking at arthritis now
Yes.
and there are several types
Yes.
of arthritis.
Mhm.
And usually, the usual symptom of arthritis is swollen, painful joints.
Mm-hmm. Yeah,
Right.
it is the inflammation of the joints.
Inflammation,
Yes.
right.
Mm-hmm.
And so,
And you usually have pain and stiffness
yes.
in the area,
Hmm.
swelling sometimes and deformities and diminished range of motions. Yeah.
Hmm.
Yeah.
So arthritis, no, there are
Mhm.
different types, but
Right.
arthritis is a general term that is used to describe a disorder that affects the joints.
Right.
So the symptoms of arthritis,
Hmm.
and which would, you know, be covered for most of them:
Yes.
swelling in
Hmm.
one or more joints,
Yes.
body stiffness
Hmm.
and pain in the joints,
Hmm.
especially during damp weather or
Right.
cold weather in the
Yeah.
morning
Yes.
or after strenuous activity.
Right.
There may be a sharp burning or grinding pain, or it may feel like a toothache,
Hmm.
and that pain is excruciating. There may be stiffness and or pain when moving a joint.
Right.
Recurring joint nor recurring joint pain or tenderness in any joint,
Hmm.
inability to move a joint normally,
Hmm.
obvious redness and warmth in a joint, unexplained weight loss is one of the symptoms as well, or fever or weakness combined with joint pain. Symptoms such as these that they last for more than 2 weeks.
Right. And so it is important to understand the joints,
Joints, right?
right?
Hmm.
Because we are looking at every part of the body that has joints
Joints.
that
Hmm.
arthritis may occur.
Hmm.
Most places, the most places is that it takes place in the knee, but you're also looking at the wrist, the elbows, the fingers, the toes, the hips, shoulders, neck, the back, the spines, and these areas that you have all different type of joints. Um, in because you have the ball and socket joint, the hinge joints, and the synovial joints. So all different type of joints are in our bodies, and so we look at all the areas in our bodies that has joints
Yeah.
when we deal with arthritis.
Yeah.
Mhm.
And what are some of the causes of arthritis? Arthritis, as we said, is the inflammation of
Mhm.
one or more joints.
Right.
And the word arthritis covers a number of disorders,
Yes.
some of which are we'll be looking at in
Mhm.
this discussion this afternoon.
Right.
And we can, we'll try to deal with the problems
Right.
that these conditions come with.
Yeah. But before you look at the conditions, did you know that when scientists excavate, when they're archaeologists,
Hmm.
when they excavate areas that people used to live, did you know that one of the things that they find out that for as long as man has existed on the earth, that they have found is that they have always seen arthritis in the bones in persons. And so there are some persons that they call Neanderthal, which I don't necessarily agree with the name Neanderthal, but because I don't believe in evolution, I believe that God created Adam and Eve, man was created. But as far back as you can go, when all these discoveries are made, they found arthritis in person. So it is not a modern thing that has happened.
Yeah.
That's been happening for a number of times,
Yes.
number of years, many thousands of years,
Right.
not millions, thousands. Yeah.
One thing that is common though is
Mhm.
that all the various types of arthritis affect the synovial joints, which is
Synovial
the
joints, yes.
synovial joints, which
Yes.
is the movable joints.
Right.
Now, as you mentioned
Hmm.
earlier, Nebert, and just for emphasis, They are the joints in the fingers, in the
Mm-hmm.
toes, in the
Right,
wrists,
right.
elbows, hips, and
Yes,
knees,
yes,
just to name a few,
yes,
or to
yes. Oh
reiterate
yeah,
a few.
yeah.
And there are also joints between
Mm-hmm.
the bones of
Right.
the spine.
That's right.
Now, each joint has a
Mm-hmm.
cartilage covering over the end of the bone,
Right.
and it is continually
Mm-hmm.
bathed in synovial fluid
Right.
in a capsule,
Yes.
right? And there are some of the types that we are going to be looking at. One
Mm-hmm.
of them is osteoarthritis,
Yes. Yeah.
right?
Yeah.
So in osteoarthritis,
Mm-hmm.
the cartilage, I'm going to tell you what the cartilage is now. The
Mm-hmm.
cartilage is a smooth, soft, pearly tissue,
Mm-hmm.
and among other places, it is found in the ends of the long bones.
Right.
It provides a smooth surface for the
Mm-hmm.
bones in the joints to slide against.
Mm-hmm.
So this is what helps the movement.
Right.
And you mentioned that joint that can rotate,
Yes. Yes.
right? hmm
Yes. Ball
So
and socket
ball
joint.
and sockets, yeah,
Yes.
right. So it provides a
Mm-hmm.
smooth surface for the bones in the joints so
Mm-hmm.
that they can slide again, so that you can have the different motions and so
Mm-hmm.
on. As a result of years of wear and improper diet,
Mm-hmm.
see how diet is
Oh
important,
yeah.
this cartilage becomes pitted,
Mm-hmm.
thin, and may even disappear,
Right. Begins to break down.
right?
Yeah.
There is pain and stiffness.
Mm-hmm.
Now, in older people, they experience this most often, and it generally occurs in the weight-bearing joints, like in the hips
Right.
and in the knees.
Right.
And in older persons, this generally occur because persons stop exercising,
Yes.
so they cause that
Mm-hmm.
stiffness.
Yes.
The connecting ligaments and muscles which hold the joint together become weaker.
Mm-hmm.
The joint may become deformed,
Mm-hmm.
there may be pain, but usually no swelling.
Yes.
So bony outgrowths may later develop.
Growth
Osteoarthritis,
spurs.
uh,
Outgrowth.
outgrowth, right?
Spur. Yes.
This growth spurs.
Yeah.
Osteo Osteoarthritis
Mm-hmm.
rarely occurs before 40.
Mm-hmm.
Rarely.
It does occur, but
It does, it does. But it affects most people
Mhm.
after 60.
Yes.
Sometimes it is so mild as to be unnoticed.
Mm-hmm.
Now, women have it 3 times as often as men.
Yeah.
Right.
Yeah.
So,
Um, uh, it is because of the developmental process of women, because there
mhm,
are things that women have to go through that men don't.
yeah.
And so, because you have to go through some of these things, then the loss of certain type of nutrients from the body, even though these nutrients are generally replaced, but
Mhm,
because these things happen, then and then the bone structure in women are just a little bit different from how
mhm,
it is in men. And so because of that, you have to ensure that the diet for women would include more of the 12 main minerals and the 62 trace minerals. You must
mhm.
ensure that happens.
Yes.
Hmm.
So, osteoarthritis is
Yes.
a degenerative joint disease, and
Yes.
as we described earlier,
Hmm.
it is the most common form of arthritis,
Hmm.
especially in the elderly.
Right.
All right. So now there are some natural remedies
Hmm.
as well for
Oh yes.
osteoarthritis.
Yes.
Yes, and
Yeah.
Nebert will be sharing some of
Yeah.
those with us.
I have some of the natural remedies that I'm going to be sharing with you. Are I'm just going to give you some of the local
Local
ones,
ones, right?
because these you can have these can be had very easily.
Mhm.
The first one I'm going to tell you about is castor oil. castor oil,
Mhm.
and you apply it to the area generously. All right, generously, and you apply it in the way that Debbie told you before when you are massaging. You
Mhm.
apply it in a circular
Circular
way
way.
because you want to apply it in the same way that the blood flows to these areas because it will get quick relief. And so it is so very important that when you have identified the area where the area that the most pain comes from, then
Mhm.
you apply it generously to this area.
Mhm.
So that is castor oil, and this is the oil, not the leaves or the tree. It's just the oil.
Just the
And
oil.
then there is a plant that is known as Christmas candle, Christmas candlesticks, Christmas candlesticks. Now, this plant is so very very important, and it is a concoction, the entire plant, the aerial section and the roots that you drink. You make a tea from this and you drink it. Now, if you want to find out like how much to apply, you probably have to contact us. You probably might have to contact us so that we can give you the dosage of that. The reason it is one of the reasons these plants are so very important is that they would have things that are known as alkaloids and flavonoids and glycerides and sterols and tannins and and the properties of them are normally analgesic and antibiotic, antibacterial and anti-inflammatory and antioxidant. This is why, and these are just some of the things that all of these plants would have,
Mhm.
why they would be so effective in working against that. Another one aside from Christmas candlestick is one that everybody knows, that cow foot. The leaves are broad, and it is both the aerial section and the roots as well. And this is very very known to be very effective for osteoarthritis, and
Mhm.
it is an infusion of the leaves that are used. Now, when you use the infusion of all of these, the leaves of these plants, you'll find that you don't only get a relief from the arthritis, but there are other areas that you will see improvements in as well, because this particular plant is good for sinusitis and so on and so many other things, and for high blood pressure. There is a grass that is known as guinea grass. Guinea grass. Many people know guinea grass. You normally cut it and give to your cows, and the cows love it. Or if you tie a cow in that area, man, the cow will demolish that area quickly. You notice that when your cows eat it, they don't have arthritis. You
Mhm.
never find that in the cows, nor it goes as well when you feed it to them, because this is a grass that prevents that from happening in your body.
Mhm.
Um, there is a herb, a flowers that many persons have, that is known as periwinkle. Periwinkle, an infusion of the leaves, very good to alleviate arthritis as well, osteoarthritis and the rheumatoid arthritis, and many different types of arthritis. This is just such a good plant for that.
Mhm.
Normally, you would see them with purple flowers or white flowers. Any one of them can be used. Now, another plant that can be used is one that is known as a colic mint. Colic mint. Sometimes we call it sweet mint, but it is known as colic mint.
Colleague.
And the roots of this is what you would use. The roots, you make an infusion from the root, and you will consume this, and it is very good for that purpose as well. Um, French thyme, which is so very versatile. And in Jamaica, it grows almost in everybody's yard. It is so very, very important, and it is has a number of use. And one of the main things that it is good for, the area section, is arthritis. Turmeric, because turmeric is an anti-inflammatory herb. The roots of it that are known as rhizome, turmeric and ginger is good for inflammation. The turmeric is so very good, and it works almost immediately. So you get the root and you would make a concoction with that, and it prevents autoimmune conditions, and it is like a super a super root that can be used in our body. Cabbage leaves also. Sometimes you pass it over the fire so it can be bent and applied to the area topically. And cabbage leaves are excellent for this purpose as well. Callaloo, many persons eat callaloo, and sometimes you find when you eat callaloo, aside from going to the bathroom, fiber full of fiber, you find
Mhm.
that the pains in your joint tend to disappear. But sometimes you don't even notice that it has disappeared because of the other things that you do as a result of that. But it is excellent for that purpose. Also, guava leaf, and guava fruit. It is not only cancer that you drink this for, and men don't only drink it for virility purposes, but it is good for many different types of arthritis as well. Pumpkin seed oil. Pumpkin seed oil. Pumpkin seeds can actually make oil, and so this is extremely good as well to apply topically on the area as well. And this one, I bet you didn't know about this one. It's the ribena bark.
Mhm.
The ribena, and the Jamaica has a proliferation of ribena trees.
Yes.
It is the bark, making a concoction of the bark that is important for arthritis. And so you find that of all the things that I have just said, about 13 of them that I just told you, and there are more. There's so much more, but these 13, if you were to use any one of them or one or more of them, you'll find that you will get relief from arthritis. And
Arthritis.
these are things you can find locally. I choose the
Mhm.
ones that are easy to be found.
Yeah. And these are for all the arthritis?
All the different
All the
types of
different types
arthritis.
of arthritis.
All different types of
Wow.
arthritis that you have.
And in addition to those remedies, neighbors,
Yes, yes.
those are the herbs, but
Yes, these are the herbs.
right. So the
Hmm.
food now that
Hmm.
you are to consume, and those that are not to be consumed.
Hmm.
And one of the major ones that which everybody has a problem with is meat.
Yes,
Meat is
yes,
especially bad.
yes, yes.
It has a ratio of 1
Hmm.
to 12.
Yes.
All right. So the organ meats,
Hmm.
these are especially bad,
Oh yeah,
such as the liver and
right.
kidney.
You should never eat
They
liver.
are even worse.
Yeah, you should
They
never eat
have
liver and kidney.
1 to 44
Yes.
of the things
Yeah, did you know
that.
that the liver and the kidney filters the blood from disease?
Yes.
So you should
Can you
never
imagine
ever eat
your
kidney
eat?
and
And
liver.
it's not just in human.
Yes, in
It is
animals.
in the
Right. So
animals.
never ever
So
eat
you don't
kidney.
eat.
As a matter of fact, don't eat meat.
Don't eat meat.
Eat meat cause inflammation. Yeah.
Exactly.
Yeah.
So the more meat you eat, the
Hmm.
more calcium you're going to need.
Yes. Yes.
It is as simple as
Oh
that.
yeah.
Right.
Oh yeah.
To really help to solve the problem, stop
Hmm.
eating all types of meat.
That's right. That's right.
So, in addition to the calcium
Hmm.
problem, meat is also heavy in purines and
Yes.
uric acid,
Yes.
both of which are extremely acid.
Yes. And the uric. Many persons don't notice. The uric acid is lodges in the joints,
Hmm.
and this would cause the pains that you experience sometimes.
Right, because
Yeah.
eventually what will
Mhm.
happen is this hodgepodge
Mhm.
of acid
Yes.
that they collect in
Yes.
the joint
Yes.
to such a degree that the
Hmm.
bone is eaten away,
Yes.
and then
Yes.
the bursa
Hmm.
becomes inflamed
Right.
and deteriorates
Terrible. Yes.
so quickly.
Hmm.
All right, so make sure throw away the meat
Hmm.
and get in your green leafy vegetables and
Right.
your whole grains,
Yes.
your oatmeal
Hmm.
and brown rice.
Yeah.
Now, these supply vitamin K,
Hmm.
and you're to eat fresh fruits, your
Hmm.
fresh pineapple,
Hmm.
as frequently as you can.
Yes.
The
Bromelain is so
bromelain,
right.
right?
It's
It
so
is
important.
so good for reducing inflammation,
Exactly. Exactly.
and it must be fresh though.
And pineapple
Yes.
is the main source of bromelain.
Yes, don't
Of
eat those in
bromelain.
the
Yeah.
can and those that have been
No.
frozen,
No.
because they in these process, those
Mhm.
are the canning process and the
Mhm.
freezing process, they destroys the enzyme
Yes.
that produces the bromelain.
Yes.
So you don't the also canned pineapple contains aluminum,
Right.
which can lead to Alzheimer's
So
later on.
so this is why we say get the fresh pineapple
Right.
and not the canned ones.
Not the canned one.
Yes.
So it has to be fresh. So
And
you
it would be nice if you were to get the original pineapple, the one that when you go to reap it, it sticks you.
right.
It has a lot of what we call maca that juke
Mhm.
you, right?
Yes.
Try to get those ones.
Now,
Get
those
those ones.
smooth pineapple that you
No,
can actually
no.
hold comfortably in your
Right.
hands. You know, when I was growing up, that's the
Mhm.
pineapple that I'm used to. Those
Mm.
that
That
has those
sticks you.
little
Right.
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 Mhm. Studies have shown that
Mhm.
bromelain reduced or eliminated swelling and inflammation in
Exactly.
the soft tissues
Yes.
and the joints
Mhm.
affected by rheumatoid arthritis,
Right.
also osteoarthritis.
Yes.
Now, the most beneficial vegetables that you can consume
Mhm.
include celery,
Right.
parsley,
Mhm.
alfalfa,
Mhm.
wheatgrass,
Yes.
garlic,
Mhm.
comfrey, and Nebert
Mhm.
mentioned some of those,
Mhm.
and endive.
Mhm.
Also, purslane,
Yes.
watercress,
Right.
moringa,
Yes.
and sargassum,
Yes.
Irish moss, etc. Those
Yes. Sea herb.
seaweeds, those
Yes.
sea
And
herbs.
the
Mhm.
and the sargassum is both many persons are afraid of it
Yes.
because when you pass some areas, I always ask the question, why is it that when you go to some areas it smells,
Mhm.
but in other areas it does not
Does
smell?
not.
And in St. Mary there are some areas that it smell and in some places it come up on the beach and you don't even know that it is there. But sargassum, because of the qualities that it has, it is you don't have to die for it and you don't have to swim far to get it. It comes to you,
Mhm.
washes to you on the shore. All of the other sea herbs you have to die for them, but this one is so very good. And in the women it is so very good because for the lymph nodes in women, it strengthens it. So all of
Strengthen the
the
lymph nodes.
right. So all of the diseases in women that pertains to the problem in the lymph nodes, it causes it not to happen.
Mhm.
So it is so very important.
Yes. And some of the beneficial fruits
Mm-hmm.
that you can some more as
Mm-hmm.
the cherries and
Yes.
of course the pineapple and bananas
Yes.
as well. All
Yes.
right. So food containing the amino acid,
Mm-hmm.
histidine,
Mm-hmm.
histidine.
Yes.
These include wheat, rye, and rice.
Yes.
Now, histidine
Mm-hmm.
helps remove metals,
Mm-hmm.
and many arthritics have high levels of copper and iron in their bodies.
Right.
So, and as we said at the top of the beginning of the
Mm-hmm.
program, Liebert,
Mm-hmm.
a lot of these conditions are as a result of our lifestyle,
Right.
and we cause these things on ourselves
Yes.
without even
Yes. We
knowing.
do. We do cause it.
So it is
Mm-hmm.
important. We have to take our diet and our
Mm-hmm.
health at heart.
Yes.
We have to,
Yeah.
so that we, prevent our bodies from getting sick
Yes.
and getting diseased.
Right.
So we
Right.
have to,
Mm-hmm.
at times, we have to go on a fast.
Yes.
At times, we have to take some washout,
Right.
as we call it, and we have to, because we have also environmental factors
Yes.
that contribute to our
Mm-hmm.
health, whether negatively,
Mm-hmm.
most times negatively. But we need to take stock and make sure that we take our health and our diet seriously,
Exactly.
very seriously. You can also do have taking your fiber, as Nebert
Oh
mentioned
yeah.
earlier.
Mm-hmm.
Eat your oat bran and your rice bran, your flaxseed,
Mm-hmm.
which is also full with omega 3, and make sure you get in your flaxseed oil on a daily
Yes, and
basis.
omega 3. Yes,
Omega 3
for sure.
fatty acid,
Mm-hmm.
yes, and this helps to alleviate arthritic
Mm-hmm.
problems. Purslane or parsley is also good,
Excellent.
also
Excellent. Excellent.
excellent in your
It
words.
cannot
They're
be
excellent.
overstated. Yes.
Mhm.
So good.
Yes, and you can go on your juice fast
Mm-hmm.
and so on. Make sure you also drink a lot of water because water
Mm-hmm.
lubricates the joints.
Right.
And you
Right.
need to
Especially when
ensure
you drink
that
it
you,
properly.
yes,
Yeah.
swish it around
Mm-hmm.
and swallow.
Right.
And you do that right throughout the day.
Right. You give the brain a chance to work. The only water
Mhm.
you don't switch around is when you drink it first in the mornings.
Mhm.
Right. Yes.
Yes. And you, of course, you can do a variety of things.
Yes.
You may not have to do the same thing every
Yeah.
day.
Yeah.
You can break the monotony, but you green leafy
Mm-hmm.
vegetables, you can
Mm-hmm.
juice them
Yeah.
as well. Make
Yes.
sure you get in your fresh fruits,
Mm-hmm.
eat them, and you can
Mm-hmm.
also drink them.
Mm-hmm.
And make sure you drink some like raw potato juice. All right, you can slice a potato
Mm-hmm.
with the skin on,
Mm-hmm.
wash it carefully and slice it. Then you can cut it into thin slices and place in a large glass. And you
Mm-hmm.
fill the glass with cold water
Mm-hmm.
or room temperature and let
Mm-hmm.
it stand overnight if you
Mm-hmm.
want.
Yeah.
Yes, it's best overnight because then it will pull all those
Right.
nutrients
Yes,
from it.
ma'am.
And
Yes.
then you drink the water the next
Yes.
morning
Yes.
on an empty stomach.
Yes.
Now, potato juice can also be made you can put it in a juicer and you
Mm-hmm.
can make it fresh
Mm-hmm.
and then you dilute it. So you do 50-50.
Right.
The same amount of,
Mm-hmm.
of juice to the same amount of water.
Yes.
And then you drink it first thing in the morning.
Very important. Yes. Because it is not only working on your joints; it is working on your stomach as
Stomach
well.
as well,
Yes.
right?
Mm-hmm.
People who are low
Mm-hmm.
in the antioxidant compound,
Mm-hmm.
which is glutathione.
Right.
Now, these persons are more likely to have arthritis.
Yes.
So vegetables that
Mm-hmm.
are rich in glutathione
Mm-hmm.
includes asparagus,
Right.
cabbage, cauliflower, potatoes, and purslane.
Yes.
So you can use these to help. All
Mm-hmm.
right. Blackstrap molasses
Mm-hmm.
and apple juice or grape juice
Right.
also helps.
Yes.
All right.
Mm-hmm.
So getting your vitamin
Mm-hmm.
C's, your folic acid, your vitamin B12 and
Mm-hmm.
iron and so on, and make sure you can get most, if not all of these things from parsley or purslane. So you
Mm-hmm.
can get these in. Make sure you get in your vitamins
Yes.
and your
Um.
iron and so on.
True. I you notice that milk, wheat, eggs,
Mhm.
corn, pork, and soda drinks have been shown to produce arthritic
Arthritic
syndrome.
symptoms, yes.
So try to avoid those. And
Hmm.
aside from that, I'm going to repeat that milk, wheat, eggs, corn, pork, and soda drinks. Avoid those. They bring on the arthritis. They bring that on. And do not take iron supplements. Do
Hmm.
not take iron supplements or multivitamins containing iron. Iron is suspected to being involved in the pain and the swelling and the joint destruction. All right, so do not take any type of nutrient that you need. Ensure that you get it from the food you eat. So when you do the supplements, try to get it from the food. The supplements, how your body identifies it is one thing, because your body identifies food. Food, your body identifies food, and your body does not identify non-food as food. All right, so make sure that you do that. For example, you know why when persons drink alcohol, consume alcohol, there's normally you smell it on them and their brain function is not well, because it cannot be digested,
Digested.
and so it circulates all over the body. It goes in the bloodstream very quickly, and it circulates to your brain, and it circulates um, almost everywhere. So you find that the person seem to have relieved themselves of cognitive thinking, and so these are just one thing that your body don't identify as food, and so these cause problems in your joints and so on. That happens.
And
Mhm.
our arthritic patients frequently have they develop liver disorders.
Of course,
So
of
you
course,
want to
especially
make sure,
sclerosis. Yes.
yes, you
Hmm.
want to make sure that your diet is on the up and up,
Oh yeah.
right? And arthritis is caused by acid and waste matter that is in the body,
Right.
which eventually becomes solidified
Hmm.
and lock your joint. So
Yeah.
this is why you have that stiffness.
So exercise is
Now,
important.
this condition
Hmm.
is caused and aggravated by
Hmm.
improper diet. And those
Yes.
things that Nebert mentioned earlier,
Hmm.
like the eggs and the bread and the milk and the
Right.
meat,
Yes.
salt and sugar, now these are the worst intakes that we can use.
Right. If you use salt, use Himalayan salt or
Yes,
Celtic salt.
yes,
Get the good sea salt.
right,
Right. Use those, but not
yes.
the regular ones that have
Mm-hmm.
like additives, like iodine and all of these things that are added.
Mm-hmm.
Iodine is in this way is never meant to be digested
Yeah,
in your body. It does
yeah,
not help you. Yeah.
yes. Now, the use of extremely the hard water,
Hmm.
that is what the ice and so on,
Yes.
right? Now,
Hmm.
these will accentuate an arthritic
Yeah.
condition.
And salt water too.
But
Yeah.
water,
Hmm.
just drink the regular
It's
water.
spring water.
This
Yes.
will help to relieve,
Hmm.
because now this will lubricate the joints and eliminate the
Hmm.
stiffness and the
Hmm.
buildup and the
Right.
deterioration of the cartilage and
Right.
so on.
Right.
All right. So these are very important
Hmm.
information
Yes.
for us. And sometimes we say we have pain, we
Hmm.
sit for a little while, and when we get up, we have the pain, and we say, oh, why may I get old?
And it
But
is not a disease
it
based on
can,
age.
no,
Yeah.
no. I was looking at something the other
Hmm.
day, and the thing it you put in some information,
Hmm.
these AI things,
Yes.
and you
Yes.
put in some information,
Hmm.
and then the what comes, the result says you are at a certain age. For
Hmm.
example, you're 40,
Mm.
but because of your immobility and because of the you don't exercise so much and you don't drink so much amount of water
Hmm.
and all of that,
Yeah.
you are like you are like 60,
Mm.
you're like
Wow.
50 to
Wow.
60.
Whoa. Yeah.
So
Hmm.
it is important,
Hmm.
listeners, viewers, that we take in the have the intake of
Hmm.
these things that nourishes our bodies
Yes.
and that helps our bodies to heal and to repair itself,
Right.
because we know our bodies repair
Oh yeah.
itself,
Oh yeah. Oh yeah.
right? And we have to put the things in
Hmm.
that help to
Yes.
this process.
Yes.
All right.
There are some very very important things too,
Mm-hmm.
Debbie,
Mm-hmm.
that you can use. So we are going to be giving you some more herbs, all
Yes.
right,
Mm-hmm.
and we are going to be telling you some more things to avoid,
Void, right.
because it is so very important.
Mm-hmm.
Arthritis is caused, as Debbie said, by the acids that you take into the food. So make sure that you try to avoid all of these as well, because if you don't, then you're going to find yourself in big problem, big
Mm-hmm.
problem.
Mm-hmm.
Um, and as David said before, try to include the green leafy vegetables. The reason I'm repeating this is because purslane
Mm-hmm.
is found in everybody's yard,
Mm-hmm.
and it can be found all about the place. And to avoid arthritis and to eat the things that your body needs, purslane has everything in it. Purslane, moringa, and and um and watercress.
Watercress,
These three,
yes.
purslane, moringa, and watercress. Don't
Mm-hmm.
combine them.
Mm-mm.
Do not combine them.
No, no.
Eat them separately.
Mm-hmm.
All right, because once you combine them, then it will be too much for your body to intake
To
at the same
break
time.
down, yes.
Yes.
Mm-hmm. And some of the things that you are to avoid,
Mm-hmm.
or before I tell you what you to avoid now,
Mm-hmm.
for eliminating toxic substances from your bowels,
Yes.
there are one you can use, like slippery elm
Mm-hmm.
or white oak bark tea. You
Yes.
can, just to remove these things from your
Yes.
your body.
And slipper elm is a nice, pretty name, but in Jamaica we call it basida.
Basida.
All right,
Yes.
almost everybody knows this. All
Mm-hmm.
right, and it is the inner bark that you use. You get rid of the outer bark, and then
Mm-hmm.
you just use your knife or your cutlass or sharp instrument
Mm-hmm.
to just to scrape it and use that.
Yes.
So this is very
So
good.
these barks are
Hmm.
good too because there
Hmm.
are a lot of them that you can use.
Oh
Kohash, you can
yes,
use
oh yeah,
buckthorn bark,
yes,
um, gentian root,
yes,
skullcap, or
yes,
valerian root.
yes.
Yes.
And valerian is popular in Jamaica now. You can go to the health stores and get these.
Hmm.
Hmm.
And you can use some poultices as well
Right.
to relieve pain. So
Yes.
like the cayenne,
Yes.
lobelia,
Yes.
mullein, and
Yes.
the slippery elm again.
Yes. And the cayenne is so
So
cayenne
so
has the
very good.
ability
Mm-hmm.
to penetrate your skin
Mm-hmm.
and to go in, and so it's not just to drink it, it is also to use it as a poultice on the skin.
Right,
So
right.
very important for
Yes.
that purpose
And
as
you
well.
can use it with a carrier oil
Right. Right.
to make the poultice
Yes.
as
Olive
well.
oil, coconut oil
Oil.
can be used. Yes.
Yes. And you can use bear's foot,
Mm-hmm.
bitter root,
Mm-hmm.
blackberry,
Mm-hmm.
black cohosh, as I said,
Mm-hmm.
and Irish moss,
Mm-hmm.
saw palmetto,
Yes.
berries,
Mm-hmm.
skullcap,
Mm-hmm.
wintergreen, yellow
Yes.
dock.
So the sour palmetto berry. Now this grows prolifically in Jamaica,
Mm.
and you just need to know. You just need
Where
to identify it.
right.
So once you identify it, then you
Yes.
say, "Oh, this is the thing that can be used for so many different things." But
Yes.
sour palmetto is so very important.
Yes.
Yes.
God is so amazing,
Mm-hmm.
Nebert. Look at the amount of herbs, the
Mm-hmm.
amount of
Yeah.
remedies
Yes.
that He has made for
Oh
us.
yeah.
And the amazing thing about
Yes.
these is that they are not just good for one condition. They
Mm-hmm. They're
can
good
be
for
used
a
for a
number
number of
exactly.
conditions.
It does not cause problem, but
No.
when you take the drugs cause other problems to develop.
Mm-hmm.
But when you do the herbs solve other problems that exist. Sometimes you didn't even know that these
Exactly.
things exist.
Exactly.
There is a herb that is known as cat's claw.
Mm-hmm.
Because sometimes we call them cockspur and all different kind of names we have for it, and it is so very important for relieving arthritis pain.
Mm-hmm.
When we go in the bushes and we are walking through the bushes, it catches on your clothes and it want to tear you, and this is one of the things that is excellent also because it is so powerful in antioxidant one, and when you do it with ginger, when you do the castor and the ginger, oh man, this is very good
Yeah.
to relieve arthritis pain.
Mm-hmm.
Yeah.
And it is important, listeners, viewers, that you oh, and here we have a comment, yes, from
Yeah.
one of our viewers,
Yes.
Rick. Rick says, "What would be a good substitute for bread?" What would be a good substitute for bread?
Yes.
That's the question. And
Yes.
then he made a comment as well while we
Yes.
answer that. The cabbage leaves is good for pain also. Yes, and it's
Yes.
very powerful. You
Yes.
can actually just quail just
Hmm.
get off one of those big leaves.
Yes.
You can quail it a little bit
Yes. Apply
and
topically.
apply it topically.
Yes.
Put a wrap over it and keep
Yes.
it on your
Yeah.
knees
We mentioned that
overnight or
earlier.
your
Yes.
hip overnight.
Yes.
Yes, you can also make a
Yeah.
poultice with it.
Oh yeah. Oh
Yes, you
yeah.
can beat it in the mortar,
Yes.
use it with a carrier oil or
Right.
by itself
Hmm.
and put it on the area. Yes, it's
Yes.
powerful.
And bread is
And
made from wheat, right?
yes,
And so they are breads that can be made from other things
yes.
aside from wheat because you can make it from cassava as
Mm-hmm.
well.
Mm-hmm.
You can use that another type of one. It is sold in Rockabessa. It is sold just nearby here. Another type of flour,
The spelled flour.
spelled flour, you can use as
Mm-hmm.
well. I make
Mm-hmm.
bread.
Yes.
So bread does not have to be made from
The
wheat.
flowers that we
Right.
know, the regular
So
flour.
there are substitutes
Yes.
that can
Yes.
be used for that because you want to avoid the wheat
Yes.
and you want to avoid those type of biscuits that are
Mm,
made from the wheat as well.
And you can
Mhm.
use even chickpea.
Right.
Chickpea can make flour as well.
Exactly
You
so.
can blend it
Beautiful.
and
Yes.
grind it up and put it to
Yes.
dry,
Yes.
and then you can blend it again
Yeah.
dry
Yes.
and until it becomes a flour,
We
and
are
you
doing
can
some right
use
now.
that. You can use that
Yes.
and you can
Yes.
make your own bread, Rick. You can
Of
make your
course.
own
Of
bread.
course.
Yes.
And it's not a hard process.
No, it's
Yeah.
not. So
Recipes are found all over the
we
internet and
have
that.
to
Yes.
take our health in
Mm-hmm.
hand and
Yes.
make sure that,
Mm-hmm.
because you know a lot of things are provided out there for us that
Mm-hmm.
are not good for us.
Yes.
So we have to spend the time
Yeah.
and make it
Yes.
and make ourselves healthy.
Mm-hmm.
So some of the things that we are to avoid now,
Mm-hmm.
make sure you reduce the amount of fat that is in your diet.
Definitely
Avoid
so.
the dairy products, and Nebert mentioned some of them
Yes.
earlier, the milk and
Mm-hmm.
the eggs and so
Mm-hmm.
on.
Yes.
All right. And the dairy products and those fatty foods.
Yes.
You must also avoid those hydrogenated oils.
Yes. Some oils we call some of them vegetable oil
Hmm.
and what's the other one? I think come from
Canola and
right
all of.
and
I
those
don't know
things.
what canola is. I've
Well,
never seen
well, the can means Canada, so it comes out there. But
it.
try to avoid things you cannot identify that can make
Hmm.
oil because we don't know vegetables can make oil,
Right.
and what we don't know. If you don't know what it is, leave it out.
Yes.
You know.
And in bold and all
Hmm.
caps, do
Hmm.
not eat meat.
Yes. Yes.
And
This
I'm
is
saying it as nicely as
yes.
possible. Do not eat meat. All right, because as we said before, the purines and the uric acid in it inflame the arthritic conditions.
Right.
And if the blood is too acidic, the
Mm.
cartilage in the joints can dissolve.
Right.
So stop the meat diet.
Yes. And we are not doing it maliciously.
No,
We are doing it
no.
because we want your health to improve,
Improve, yes.
and and also for you
And
not to have certain
it can be
conditions in
done.
your body.
Yes.
Because one of the things that we have found is that when you eat this, then maybe about 2 3 months after, they
Hmm.
find that there are still lodgements of it in your large intestine,
Hmm.
in your colon. This is why colon cancer is so prolific in Jamaica. So don't eat it because it also causes terrible, terrible, terrible arthritis.
Hmm.
Yes.
And do not eat anything with added sugar.
Right.
And
Right.
just read the labels.
Yes.
Just read the
Yeah.
labels. A high protein diet induced arthritis in research
Mm.
on that they did on pig.
Yes.
Right? So there are certain things that are good for you
Hmm.
normally under normal
Yes.
circumstances, but when you treat with arthritis, there are some things that you are to avoid.
Hmm.
So you avoid caffeine. Well, caffeine is not good for you.
Hmm.
Tobacco is not good for you,
Hmm.
and avoid the citrus fruits while you're treating with the situation. All right. Also, some arthritic are sensitive to foods in the nightshades
Yeah, because,
family.
because I remember we said nightshade is good enough. Yeah,
Yeah,
but they
yeah,
are
but
not all of them.
right.
Yes.
So, like
Like
eggplant and
right.
white potato
Yes.
and bell pepper, tomato, and
Yeah.
tobacco because
So notice the ones that we're telling you are the GMO ones
hmm
because potato is not supposed to be white.
no,
You understand?
no,
And we don't know where eggplant come from.
right.
And we don't know where some of the things we don't know where they come from
Yes.
because persons have made these are invented
Mhm.
things. And
Right.
so these are the ones that you avoid. And they contain so many other things,
Oh yes.
solanine and so on. You could,
Yes, they and
mhm,
because the solanine
mhm.
interferes with the muscle activity.
Right, right.
So there are some studies that were done
Hmm.
in one research study. 85% of arthritics were
Hmm.
benefited when they stopped using those foods that we mentioned.
Right.
Unfortunately, such items are sometimes included in other foods as natural ingredients,
Right.
but they're actually not.
Right.
One research study also found that 28% of those avoiding nightshade plants
Hmm.
but were unknowingly eating foods that had these ingredients than they were labeled natural ingredients. they had a marked positive response
Yes.
for the
Yes.
Solanine,
Yes.
and another 44 had a positive response.
Yes.
So, not eating those foods helped about 68% of those who did it.
Right.
Who did it? All
Right.
right. Also, chocolate,
Yes.
and there are some teas,
Mm-hmm.
coffee, and cortisone injections that some persons take. These may also cause problems.
Yes. And you notice that these are things that we love.
Mhm,
You love
mhm,
chocolate, so
mhm,
but you love caffeine, you love tea,
mhm,
and but these things are not good for your health.
mhm.
These things cause problems to exacerbate.
Right.
All right. Yes.
Do not use iron supplements
Right.
or
As I said
vitamin
before.
mineral
Right.
supplements
Yes.
that contain iron.
Right.
So
Right.
get your iron from
Mm-hmm.
food.
Mm-hmm.
You can get it from the blackstrap molasses
Yes.
and broccoli,
And
etc.,
banana.
and bananas and those leafy greens
Yeah.
and those
Right.
foods that
Yes.
contain iron.
Yes.
Reduce your body weight,
Mm-hmm.
and you will reduce the amount of pain
Yes.
in your spine, in your
Mm-hmm.
knees, your hips, your ankles, and your feet.
Right.
All right.
Yes.
Yes. So we have to do our overall thing. We have to
Mm-hmm.
do our overall thing.
Our health is so very important.
Very.
So once our health starts to deteriorate,
Mhm.
then we won't be active in life and we won't enjoy life.
No.
And so the things that you love to do, you'll be restricted. You won't be able to do them as
Mhm.
much as you used to do them before.
Mhm.
And then you won't be healthy and you'll be spending all of your money on medical bills and so on. And what you find is that once you start with the medical bills, it's just going to be piling up and piling up and piling up and piling up until you reach a place where all your monies have been exhausted.
Mhm.
And so to avoid all of that, just try to eat healthy in the
Right.
beginning and eat very well.
Yeah.
Because when you eat healthy, what I mean by eating very well is to eat healthy.
Yes.
Eat
Not
healthy.
not not a lot.
Yeah. We're talking about the rich foods, that caused the problem in the
Yes.
first place.
Or don't
Mhm.
overeat as
Yes.
well.
Right.
Right. And we some weeks ago we looked at hydrotherapy, Nebert, and we
Mm-hmm.
discovered, and we
Mm-hmm.
have said it on this program, that hydrotherapy can cure or remedy so many problems, so many health conditions that we suffer. And hydrotherapy can help in this case as well.
Mm-hmm.
So for persons who are not able to exercise your joints because of the pain and so on,
Mm-hmm.
you can do
Mm-hmm.
hydrotherapy,
Mm-hmm.
right? And you can
Mm-hmm.
do you can
Mm-hmm.
you can do the exercise program in a
Mm-hmm.
tub
Mm-hmm.
of warm water,
Yeah.
and this is supposed to be about 93 to 98 degrees Fahrenheit.
Yeah.
And you can also place the cold gel packs
Mm-hmm.
on the inflamed joint,
Right.
and this will help to relieve the pain.
Yes.
And you can alternate with
Mm-hmm.
applications of heat.
Yes.
And I'm sure if you have been listening to the program, you know how to do this alternation. You do 30 minutes of heat,
Mm-hmm.
and not so long minutes, just 30 seconds or so of cold,
Mm-hmm.
and you alternate this.
Yeah.
You can also use charcoal poultices.
Mm-hmm.
You can apply this to the affected area, the affected joints. Hot packs can also be applied to the stiff joints, and they tend to relieve the morning stiffness and so on. Hot tub baths also provide relief. All right, and or in the morning, you can take a hot shower, and this can help to relieve the morning stiffness as well. And there are myriads of herbs
Yeah.
that we can still use. Some of them we mentioned before, where you can use alfalfa, peppermint, buckthorn bark, ragworth, burdock root, and chaparral. Now, researchers in India
Mm-hmm.
gave 1.5 to 3.5 teaspoon ginger to
Mm-hmm.
patients with osteoarthritis
Mm-hmm.
and rheumatoid
Mm-hmm.
arthritis, and more than seven. Ginger, ginger.
Right.
They gave them ginger.
Mm-hmm.
Yes,
Mm-hmm.
and more than 75% experience some or a lot of relief from
Yes.
pain and swelling. So
Yeah.
it relieves the pain
Yes.
and it relieves the inflammation as well.
Yes.
So the swelling goes away and the
Yes.
pain goes away.
Did you know? Well, did you know that in Germany,
Yeah.
in Germany, they use like net leaf for its anti-inflammatory properties
Yeah.
on arthritis.
Yeah, and just to reiterate the
Mm-hmm.
point, Nebert, that
Yes.
when you use these natural remedies,
Mm-hmm.
you don't have any complaints later on,
Right.
because
Yes.
persons have done this for
Yes.
2 years
Yes.
and none showed any ill effects after taking the
Mm-hmm.
high doses
Mm-hmm.
of the
True.
ginger for
That's so
two
true.
years.
That's so true.
Yes, but
Yes.
after you a month of taking these drugs, oh
Yeah.
boy, you
As you
have
said,
so
you're a
many
pharmacy.
complaints.
You become a walking pharmacy.
Yes, because now
Uh-huh.
you have to get another one
Yes.
to alleviate another
Yes.
problem.
Yes. Yes. Yes.
Hmm.
Um. They in Polynesia peoples in the South Pacific, for over 2,000 years, it has been shown has used noni. You
Mm.
know, noni,
Hmm.
noni as a sacred plant for arthritis and arthritis pain.
Hmm.
The Polynesia, no, if you
Yes,
have you go to some places, Germany, use one
and
set.
it's so prevalent here in
Exactly,
Jamaica.
exactly. Olive leaf extract is good for arthritis. Olive leaf
Hmm.
extract is good for that as well. And this one I know will shock you. You know the willow tree,
Hmm.
right? Do you know that the willow bark is good for pain and inflammation? The willow bark is good for pain and inflammation. You have to be directed as to how to use it, but it is extremely good for that as well. So you don't just go and use it. You have to be directed as
I
to how to use
I dare say we can close the pharmacy.
it. Yeah, yes, yeah. And there are
And
some, yeah,
the cayenne is very important.
yes,
You know what
oh
cayenne
yeah,
does? Cayenne interferes with pain perception.
right,
So when
right,
it is placed on the extremities or the trunk,
yeah,
it triggers the body to release endorphins,
endorphins, yes,
endorphins, yes,
yes,
which reduce
and
pain.
endorphins.
Endorphins,
Mm-hmm,
right? Thank you.
mm-hmm,
Endorphins, that's the
mm-hmm,
correct word,
mm-hmm,
which reduce the pain.
mm-hmm,
All right, but you have to be careful. Don't get it in your eyes.
mm-hmm,
All right. Now, some people are too sensitive to cayenne to put it on their skin,
mm-hmm.
but you can
Like
put
a
it
cloth,
on
yes,
a cloth,
mm-hmm,
and then you put it, or you
right,
can put some castor oil,
yeah,
olive oil on
right,
the area
right,
to, for that
mm-hmm,
soothing, for it to
mm-hmm,
be soothing.
mm-hmm,
And then you can wrap it in some gauze, and
mm-hmm.
then you put it on the area
Yes,
overnight,
yes,
and you can use
yeah,
it.
and
Turmeric, as Nebert mentioned before,
yeah.
as well.
Yeah, just a
Yeah.
little bit more on the can. Is that
Hmm.
many persons are afraid of can because it says it burns.
Hmm.
It burns. Did you know that when you take can in the mouth, that a few seconds after you don't even
You
remember
don't
that you
even
took, you don't
remember.
even remember that you took
Yes.
it. Yes,
Hmm.
yes.
Yeah. And anybody can take it.
Oh yeah, anybody
Anybody
can
can
take.
take it.
Anybody can take it.
If you have high blood pressure, you can
Hmm.
take it. If you have
Right.
low blood pressure, you can
Yes.
take it.
And
If you have none of them, you can
yes.
take it. Your pressure is
Oh
normal,
yeah,
you
yeah.
can take it.
Curcumin that is found
Hmm.
in turmeric
Turmeric,
is the
yes.
reasons is one of the reasons why it is so effective
Hmm.
to use with arthritis.
Hmm.
Um, because the curcumin is anti-inflammatory, it is
Hmm.
pain relief, it has pain relieving property,
Hmm.
and it is good for all type of anti-inflammatory conditions such as arthritis.
Hmm.
The recommended dose, however, is something that you have to be careful about. because you should not go over 600 milligrams daily when
Right.
you're using it for that purpose.
Hmm.
Right.
Yes, and you mentioned sarsaparilla before.
Sarsaparilla.
Yes,
Yes.
sarsaparilla,
Mhm.
and we mentioned chaparral before,
Yes.
and licorice root also.
Yes.
It
Yes.
has anti-inflammatory
Hmm.
properties,
Hmm.
and it's useful in treating arthritis as well. All
Hmm.
right, so this can also be used.
Hmm.
And um, the cohosh, the black cohosh, and
Hmm.
chamomile, bearberry
Yes.
leaves, you
Yes.
can combine these
Yes.
with
Yes.
pokeweed root,
Hmm.
and sassafras,
Yes.
and you can use these. You can steep
Hmm.
1.5 teaspoon
Right.
mixture in a cup
Hmm.
of boiling water for
Hmm.
10 minutes, and you can take a cup in the morning, and in evening you can sweeten it if you desire with
Hmm.
some honey or with some agave if you desire.
Right.
If not, if you are able to, you can drink it like that, and that works
Yes.
well as well.
Yes.
Mhm.
Yes.
Tea for arthritis.
Yes.
Yes,
Yeah.
you can use
Hmm.
it. Yes.
Yeah.
So, and the poultices can be used
Hmm.
as well, as
Yeah.
we mentioned,
Yeah.
to promote, we can to relieve pain
Yes.
and to pull.
Hmm.
Charcoal is very good as
Yes.
well. It
Yes.
it also relieves the pain, and it
Hmm.
pull all the toxins and
Hmm.
all these things out,
Hmm.
and it also helps with the circulation.
Right. The eucalyptus oil
Hmm.
is so very, very important as well
Yeah.
to use.
Hmm.
And eucalyptus, many places in Jamaica have eucalyptus trees.
Eucalyptus tree. Hmm.
So the eucalyptus oil is extremely good.
Yeah, and you can even make a poultice with the leaves
Right.
to put on it and wrap it in a
Exactly.
plastic wrap and apply it.
Exactly.
Or you can use the oil with a little bit of water,
Hmm.
and you can rub it on the area,
Right.
right? And you
Right.
can apply
Hmm.
apply heat to
Hmm.
the area as well.
Right.
You can use hot towels,
Yes.
so you can roll the towel, pour the water on
Hmm.
the roll it tight,
Hmm.
pour the water on it,
Yes.
and then you can just put it on the area,
Yes.
right? And it
Yes.
holds the heat for a longer
Yes.
time
Yes.
rather than when it is open
Hmm.
and wrung out. So you can put it on the area and use it. You can also apply packs of warmed castor oil,
Hmm.
moistened comfrey tea
Hmm.
leaves.
Yes, I
So
comfrey.
so
Yes.
you use the comfrey to make the tea,
Yes.
and you can use that as the
Poultice.
poultice.
Right. So it is
Yeah.
versatile.
Yes,
You can use it
even
as
the
a tea.
grated raw
Yeah.
potato.
Right.
But
Hmm.
for some persons, the
Yes.
raw potato may be a little harsh for some
Right.
persons,
Right.
because I've experienced
Right.
that.
Right.
So you can
Don't
use
put it
those other.
directly.
Don't
Don't put
put
it
it
directly
directly
on the
on the
skin.
skin.
Yes.
And Rick is saying, I drink cayenne almost every day in water.
Yes. It's very good.
It's very good.
It's very
It's
good for
very,
a
very good.
number of
Number of
things,
things.
and
Yes.
it prevents you from having like ulcer stomach when you do that.
Hmm.
And some persons would not believe that cayenne pepper is good for ulcer stomach too. So it is very good. So
Hmm.
cayenne pepper is so versatile that I use for a number of things.
Right.
Hmm.
Also, this is they said this is an odd treatment, but
Yes.
stinging nettle plant,
Hmm.
it can also be used, and it has given success to a number of
Right.
persons.
That's what I was saying earlier. That in
Hmm.
Germany,
Hmm.
in Germany, it is used for its anti-inflammatory properties. Now,
Yes.
one of the things we notice is that a number of persons go to Germany for health.
Hmm.
As a person, almost all of the athletes, when they have health issues, they go to Germany.
Yeah.
And one of the things that we notice is that Germany is a country that taught us how to use the nettle leaf. Right? And there are other things that they have done as well in other areas, but
Hmm.
they're excellent in health.
Yeah.
Yes.
And as we said earlier, the hydrotherapy can
Hmm.
also be used to
Right.
alleviate
Ex-
the
yes.
arthritis
Right.
pain.
Right. And that is so
Hmm.
beautiful because it is not just the herbs, it
Right.
is the water.
Yes.
How you use water here is so very important to avoid illness or to cure certain type of illness that you have.
Also, drink a lot of water.
Yes.
Before bed too.
Right.
Somebody was sharing with me over the weekend that she drinks a lot of water at night before she goes to bed.
Oh yeah.
So it will help her in the morning.
Right.
For with stiffness of the joints.
Of course
and
it
so
does.
on.
Of course
So
it
it
does.
helps to lubricate the
Yes.
joints.
Yes.
And while you sleep, your body repairs and heals, so you can you do that.
Yes. I drink water at night, and I drink water as if I am once I wake. I am awake. I just take a mouthful of water.
Yes. Somebody else
each
was
time.
sharing that with me yesterday too.
Yeah.
That when she gets up to use the bathroom, she drinks
Yeah, man,
more
just use a
water.
mouthful of water.
Just a mouthful.
Yeah, because water flushes the system and help for lubrication.
Yes.
Sometimes you find that in the morning when you wake up, your joints are stiff, especially your fingers are stiff. You can't bend them.
Yes.
If you were to try drinking water before you go to bed, and then one of the things you realize is that the lubrication over there when you get up in the mornings, just put it in the mouth, flush it around, just swish it around, and then you swallow. Never ever drink it straight at night. If you drink it straight up at night, you're going to get up quite a lot to go and pee, to use the bathroom.
Right.
Flush it around first. Once you flush it around, swish it around in your mouth, you find that it goes to the areas that need it, and you won't use the bathroom as much. As a matter of fact, you won't even want to use the bathroom. Just swish it around in your mouth.
Yes.
Keep it long enough in your mouth where your brain, where the what you have in your mouth is registered in your brain. And then when you swallow, when it goes to your stomach, it does not spend a long time there. Your brain will send it to the areas of your body that needs it. And so you find that there wouldn't even be any that is left for the bathroom for that purpose. Yes.
And there are other things that can help too. Exercise is very important.
Yes,
so
yes.
exercise is very important in both preventing and treating arthritis.
Yes.
Joints which are not used tend to stiffen. So practice bending all of your joints, not merely the affected ones, in different positions, about 5 to 10 times twice a day.
Yes.
You can do that exercise.
Yes, very important.
Also, swimming. Though for those persons who you can and who love to, swimming is an ideal exercise for maintaining joint flexibility and stamina. Since the water supports your body, and as we learned in hydrotherapy, muscles can be exercised without straining your joints.
Yes.
You have some persons who do exercise in the water, which it eliminates the strain on the joints. So you can do the exercises in the water, you can walk, you can even run, and do the knee lifts and so on in the water, because it takes the pressure off your joint. Good posture, as we said at the beginning, was one of the cause. Bad posture, I should say. Bad posture was one of the cause of arthritis. So practice good posture, and that is important. So because poor posture does not distribute weight evenly, and can intensify the problem of arthritis.
True. Omega-3 fatty acid. I don't know if we mentioned that before. Omega-3 fatty acids found in so much vegetables like parsley, flax seeds, and purslane, flax seeds, chia seeds may alleviate symptoms of rheumatoid arthritis by suppressing the immune system reaction that causes joint inflammation. All right, so make sure that you take these in as well. There's something that is known as gamma linolenic acid, GLA. It is something that is found in omega-6 fatty acids. Omega-6, usually when we talk about omega, we normally say omega-3. But in this instance, we're talking about omega-6. This may ease the symptoms of rheumatoid arthritis by suppressing the productions of prostaglandins. All right, prostaglandins that trigger inflammation And so you will try to get as much omega 6 as you possibly can.
Okay.
Now, there are some persons who have done some sort of a they call it operation to enlarge certain parts of your body, like your chest area. Women,
Mhm.
um, they can be leakages,
Mhm.
and aside from poisoning the entire body, um, one of the places that it goes to is in your joints, right?
Mhm.
And usually when they use silicones, all right,
Mhm.
it causes a big problem in your joints. Now, we are not sure whether this is rheumatoid or osteoarthritis or whatever it is, but it is silicone in the joints. Now, it is very, very important to to try to not do these things, although you want yourself to look better. But these things, once the leak takes place, then your entire body is going to be poisoned.
Yes. Right. And as we said, the the things that we do affect us later on,
Exactly.
right? And we need to also reduce stress in our lives. Worry, anger, and similar emotions, they
Hmm.
weaken your body
Yes.
and help induce arthritic problems. As
Yes.
simple as you take it.
Yes.
All right?
Yes. Yeah.
And we just want to say this is all the time we have for for this
All
afternoon.
right. It has been 2 hours and it went by
Yes,
so quickly.
so quickly.
Yes.
Yes, and want to thank Rick and Terry for being staying with us, and for
Yes.
those who
Yeah.
are
So
there quietly,
right.
and for those on Radio Land.
Yes.
We are happy for your
Company.
inputs and your
Yes.
company
Yes.
and your comments. And
Hmm.
yes, Rick said he did not know that I will start to do. I'm not quite sure which one is it, but yes, and let us know. Start to do it and let us
Hmm.
know what it is. God has been gracious unto us,
Hmm.
and He has given us the information, and we are to use it.
Yes.
Use it. He is the great healer, and we
Hmm.
have to put our trust in Him, our
Hmm.
confidence in Him. And we are in the last days, Nebert.
Oh yes.
We are living
Oh
in the
yeah.
last
The
days.
very last days of this earth is
Yes,
so.
and
Hmm.
we are in the third watch,
Oh
as
yeah.
we discovered.
Yes.
And we have to know, listeners, viewers,
Hmm.
we have to surrender our lives to this great healer.
Hmm.
He's not just our great healer, he's our redeemer, he's our savior, he's our friend.
Yes.
And he wants us to be his friend as well.
Yes.
He has given his life for us. He has shed his blood on Calvary's cross to
Hmm.
save us, to
Hmm.
make us healthy, to
Hmm.
make us free from the bondage of sin.
Yes.
So let us surrender all to Him and give Him everything so that He can save us when He comes. He is coming, is imminent, and it is more urgent than
Hmm.
imminent. All
Right.
right. And okay, before we go, Rick is asking how to drink the water.
Right.
Oh, that is what he was saying. He didn't
Yes.
know. Thank you for
Yes.
responding.
Right.
Yes, that is. So try that, and you'll
Mhm.
see that it works. It does.
Yes.
It does.
So how to drink the water is that you put it in your mouth and you swish it around.
Yes.
Swish it around and then you swallow.
Mhm.
Once you swish it around, you're giving your brain an opportunity to respond to you drinking the water.
Mhm.
Yeah.
Yes, thank you. All right, so Ebert, take us out with
All
prayer.
right. Let us pray. Let's pray. Thank you, dear Father, for your gracious provisions. Thank you for being with us on this program. We pray that your Holy Spirit will be with us as we leave. Give us journeying mercies. We also pray that you bless our listeners and that as they heard the presentation that was made, that we know that you directed it. And we pray that there will be something in it for somebody, that as they practice some of these things, they will see an improvement in health. Thank you so very much for your blessings and your guidance and your leadership in our lives. And we pray that you will continue to direct and guide us as we go about life's journeys. Through Jesus Christ, our Lord, we pray. Amen.
Amen. It's goodbye from Nature's
Yes.
Way. Until next week, join
Yes.
join us on this station
Hmm.
tomorrow morning, tomorrow afternoon at 2 p.m., 2 to 4 p.m. for another interesting Bible study. And on that's Monday tomorrow.
Yeah.
On Tuesday evening at 8 to 10 p.m.
Yes.
for the Blessed Hope review
Yes.
with Nebert and Anthony.
Mhm.
Tomorrow will be Nebert and Marvin.
Right.
And then on Wednesday,
Mhm.
we will have Giovanni and Rohan
Right.
on at
Thursday, yeah, 7 to 9.
7 a.m. to 9
9 a.m.
a.m.
Yes.
And on Thursday,
Mhm.
you have Anthony and Rohan 7 a.m. to 9 a.m.
Right.
So you have a week, a whole week
Yes.
of Bible study and communing with God.
Yes.
Yes.
Thank you so very much for joining us.
Yes.
Yes.
All right. Have a good week.
Mhm.
That healeth thee. I am the Lord, your healer. And I sent my word